vaccination rollout is still underway. We can see the light at the end of the tunnel, though, with more vaccines coming. We just got news from Johnson and Johnson, which could have the third U.S. vaccine to become available. It had asked regulators yesterday to authorize emergency use of its one-dose vaccine. For more on this, we want to bring in Dr. Taison Bell. He's an assistant professor of medicine in the Division of Infectious Diseases at the University of Virginia, and Yahoo Finance's Anjalee Khemlani joins us for this conversation as well. So Dr. Bell, just want to begin with just kind of what's your take on this J&J vaccine? How impactful do you think it's going to be within the context of this being a single dose, and whether or not that could get us to herd immunity maybe quicker in this country?
Well, thanks for having me on. I think this is great news. I think the more vaccine candidates we can have to offer to people, the quicker we can get to herd immunity and really break the back of this pandemic. And I was particularly excited and eager to see the results of the Johnson & Johnson vaccine because it is a game changer, in my opinion, for a couple of reasons. First is that it's one dose, so you don't have to have the debate about holding a second dose. It's logistically easier because you don't have to reschedule people. It's just one dose, one arm. And then the second reason is that it's easier storage requirements than both the Pfizer and Moderna vaccines. It's used as a different platform, a DNA cold virus. It's more stable than the messenger RNA, so it can actually stay in the refrigerator for up to 3 months, which is longer than the Pfizer or Moderna. So this is really the vaccine that's easier to distribute to rural areas and other hard to reach areas. I can see it going onto a mobile vaccine clinic and protecting their community within a day. So it really is a game changer.
Dr. Bell, looking at the vaccine rollout, there's already some concern and criticism about how it's being done and the lack of a breakdown of who is receiving this, specifically with the focus on race and ethnicity. I know that has been a concern from the beginning, from the summer, when the pandemic hit and we saw those disparities. So right now, even though we've got so many vaccines distributed and more than half of those are already administered, we're still seeing either slow uptake in communities of color or just no information about that. And that's something I know you're focused on with a recent letter to these states calling out for that, saying specifically that with the vaccines, it's literally a question of life and death. So tell us about why this letter, which has 145 signatories, is so important right now.
Well, it's very important because the COVID-19 pandemic has had such a disproportionate impact on the Black and Latino and other communities of color. We've seen that play out really from the beginning when we started tracking the data. So for instance, Black Americans, 3.7 times more likely to be hospitalized, 2.8 times more likely to die from COVID-19 compared to their white counterparts, 4 times hospitalizations for Latino Americans, and 2.8 times the chance of dying compared to their white counterparts. So it's absolutely essential that we target and focus distribution in areas that have been hardest hit by the pandemic. And that's what equitable distribution is all about. Very similar to if you have a fire, you want to start where it's burning the hottest and then work your way out. But what we've seen is that we've had either a lack of data, and when we do have that data, we see very disproportionate distribution of the vaccine. So the CDC recently released a report saying that they only have this data for about half of people who received the vaccine. More than half of states are not reporting this at all. But where we do see it, we're seeing much higher proportions of white Americans getting vaccinated compared to Black and Latino Americans. And that's certainly a problem because that's not equitable and fair distribution. And we absolutely have to work on this if we're going to turn the pandemic in a way that benefits these communities.
Some critics of this data would point to the fact that there is already known hesitancy in communities of color, whether you're talking about just mistrust of the government or in the case of undocumented immigrants, the fear that they might be picked up by federal authorities. So what can be done to kind of allay these fears of privacy?
Right. We have to make sure that the message is out there that the primary goal is to vaccinate people and not to use it for any other means. So the data that we are collecting is not going to be used in any way to either discriminate or turn you in or anything like that. That needs to be front and center. We have to close the information gap because we haven't had a national-wide messaging campaign to educate people about the vaccine and what's actually in it in the development process. And we have to make sure that people have the information that they need to make a decision about themselves. But at the end of the day, what I really want to focus on is the access problem. And we've seen across the country where vaccine distribution centers have been, they've primarily been in wealthier white neighborhoods. And that creates a geographic barrier in addition to just the hassle it is to sign up through the internet and portals and calling public health lines. So we have to lower those barriers, geographic and administrative, in order to make it much easier to sign up for the vaccine.
And Dr. Bell, I mean, just jarring statistics. I think it was Politico that reported this week that only 5% of the vaccines have gone to African Americans. And again, could be owing to the lack of data out there. But you just mentioned the distribution of it geographically. So what are solutions to get it more visible in these communities that maybe just don't have the knowledge or the know-how of exactly what these vaccines are, and get it more visible to them so that they might be a little bit more adamant on getting inoculated?
Yeah, that's, I think, a multi-pronged approach. I think definitely bringing vaccine to these communities that have been heavily impacted is absolutely essential, because adding any additional barrier on top of someone who may be working in an essential job, not sitting by a computer, maybe not have access to a smartphone, it needs to be close. We need to at least have the vaccine available in their own communities. I think we also need to leverage the community services and community leaders that are already active in these communities. So the clergy and community organizations, after school programs where people are already going to access services. We need to make this really a downhill process so that it's easy to sign up for the vaccine. And I think coupled with that, I think we need to combat the misinformation campaign that's out there and really close that information gap and accompany this with vaccine education on how to take care of yourself and your family and keep yourself safe, so that we can really allay those concerns that people may have around the vaccine.
And then lastly, what is the role of the federal government? I mean, we've seen that across the states, there's been a very uneven, kind of sporadic, if you will, rollout of the vaccine, depending on where you are. Do you think the federal government has been doing enough to coordinate that rollout, or really should this be left up to the states, since they might understand the nuances of their communities a little bit better?
Let me be clear. This is not a state-by-state solution. When we look at the staffing levels of state public health agencies, they are not staffed to deal with something like this. And for the past several months, they've been dealing with the toil of taking care of people with COVID-19, distributing resources, coordinating testing. And then we add a huge distribution effort on top of this, the largest vaccination campaign effort that we've ever had in the history of mankind. So it's not a fair thing to put on the backs of the states. We need the coordinating power, the purse power, the people power of the federal government to really get behind this. I do think the new administration is more receptive to doing this. I just hope that we can do it quickly.
Going back to the beginning of the conversation, Dr. Bell, with J&J now filing, I know that there's also concern about the lower efficacy, and I know you addressed that, but could we see some tension build if there is the quote unquote lower efficacy sent to, say, poorer neighborhoods, and the higher efficacy, the mRNA, the one that requires more laborious storage and delivery, sent to more to richer neighborhoods? And can that be addressed through this knowledge of targeting where the vaccines are needed?
I'm really glad you asked that question, because I have received this a lot. One of the things that accompanied the press release with the J&J vaccine was it did have that lower efficacy number of 72% in the US compared to 94 or 95 with Moderna and Pfizer. And you could look at that and say, well, the Moderna and Pfizer is a better vaccine, so I'd rather get that one. But there's two things we have to keep into account here. The first is that at the end of the day, what we're really trying to prevent are people being hospitalized and people dying of COVID-19. So if we look at how the J&J vaccine performed in comparison to Pfizer and Moderna, all three offered 100% protection against going to the hospital and dying of COVID-19. So 55,000 people or so received either one of these three vaccines, and 0 of them went to the hospital, 0 of them died from COVID-19. So that's a big deal. This is what can break the back of the pandemic. If we can change the virus from a potential killer to a nuisance, that's how we get the economy going again, businesses open, we get kids back in school. So that's one. The second is, the J&J vaccine the trial was actually performed at a different time and dealing with different virus, essentially. We have these variants circulating. The trial was performed in South Africa, Brazil, other parts of Latin America, in addition to the US, where we had these variants circulating that we know behave differently than the previous version of the virus. So I, for one, cannot say how the Pfizer and Moderna vaccines would have stacked up with the variant circulating, compared to the J&J vaccine. But the bottom line is either of these vaccines will protect you from being hospitalized, protect you from dying from COVID-19. And if I had the choice of either of the three, it's the one that's available to me. That's the one that's going in my arm.
All right. Well, Dr. Taison Bell, again, assistant professor of medicine at the Infectious Disease Division of the University of Virginia. Thanks for joining us, in addition to Yahoo Finance's Anjalee Khemlani.